The Institute for Neurosciences and Multiple Sclerosis is kind of a brainchild of a combination of clinicians as well as the administration. And really over the last 7 years, with the last 5 years being our main focus, we've really focused on building what we consider a state-of-the-art neurologic care center. And we have a belief within ourselves that we can provide the highest level of care, whether it's multiple sclerosis, muscular dystrophy, ALS. We want to be able to take a patient from the beginning of their diagnosis and walk them through every aspect of their care. I think we have a very unique approach to neurologic care, and what I mean by that is for a small community hospital, we do things at a very large level.
For patients with neuromuscular disease, they face a lot of challenges. One challenge that they face is that nobody is familiar with their disease. The diseases are almost all rare, and so it's hard for them to find a physician who understands the complexity of the disease, much less a team who understands their disease. Right now is an incredibly exciting time in the field of neuromuscular disease, and I'm thrilled to be part of pushing treatments for these diseases into the future.
Memorial saw a need to fill the urgent care market in the Durand area. We have needs for our community for that minor emergency care for those folks that can't get into their family practice but don't want to go to the emergency department either. So we opened the Durand Urgent Care. Durand Urgent Care is unique in the fact that it has all the services that a patient could need, from x-ray to lab.
Here at Memorial, 2017 was very exciting for the surgical staff as we were able to welcome 2 new robots into our hospital, which has allowed us to perform a wide variety of very difficult laparoscopic surgery. The Da Vinci robot allows me to do my job safer, easier, faster, and better for the patient. If I was to have surgery, I would prefer to have surgery with the intuitive robot. Memorial has invested heavily in surgical equipment, and they are highly committed to the future of robotic surgery as they feel it will benefit this community greatly.
We've had a very busy 2017. I think probably some of our most significant accomplishments were we went from unarmed staff to an armed staff, and so with that had to do a lot of training with our officers. In that same time frame, we also hired a lot. So we went from having 1 officer on duty to 2 officers on duty on every shift. And so through that, we also gained our P330, our police authority license, through the Michigan Commission on Law Enforcement Standards, MCOLS, in June of 2017, and then added to our staff as far as a volunteer program that we instituted in February. We relocated our office. We're now up in the main lobby area, which has been I think a very big positive. Certainly have greater visibility, easier access for both our patients, our visitors, and our staff.
Every year in October, Memorial Healthcare hosts Make a Difference Day. This is a great event and allows Memorial Healthcare to serve residents in the greater Shiawassee County area who are in need. In 2017, we served 276 families, offering them free hats, mittens, Halloween costumes, and food from the Greater Lansing Food Bank. Thank you to all of the community members and hospital employees who volunteer their time to make this event successful each and every year.
We opened an outpatient pharmacy at Memorial Healthcare when we saw the opportunity for our patients who are being discharged to have their medications go home with them. This would increase their compliance and hopefully make them better quicker, and we wanted that opportunity for those patients. We also saw the opportunity for our employees. We have a great group of employees, and to be able to serve them and continue to serve them in a different fashion with our science, which is the pharmacy science, is our goal.
I work through the Memorial Pediatric Clinic. The physician or the providers within that clinic are myself, Dr. Michael Kramer. I have a nurse partner. Her name's Julie Creighton. She joined us in September of last year. And we have a nurse practitioner as well, Bethany Pavone. She started in the spring of 2015. I moved to the Mitchell building in 2014. We've grown quite a bit over that time. Initially, I think I saw 2 or 3 people on my first day. Now we're averaging in the mid-20s, and between the 3 providers, we've broken 70 several times during the winter. So it's quite a busy practice. It's exciting to come to work every day, so I enjoy it. And I think that translates to our patients. They can sense that when they come to see us.